Yeah, it's a good question. It's a complicated subject. I think there's different kind of buckets of where is performance kind of lacking. I'd say that overall there's been really good progress, it seems, in aggregate around preventing hospitalizations and doing things like that, skilled nursing facility utilization, diminishing that. I think part of the challenge has been what is the distribution of the cost structure, particularly with respect to pharmaceuticals. I think for many participants, they feel like that's largely out of their control. They feel that they're using, or their care is roughly in line with evidence-based guidelines, particularly NCCN guidelines. So the price of pharmaceuticals is difficult for them to manage, and they feel like it's outside the span of their control. So I think this has been one of the recurring issues. I think other issues in terms of performance, I think one thing we see is, I think for many practices, it's been hard for them to actually interpret what's driving their performance, particularly what cancers are problematic with respect to methodology, or where are they going over, understanding what's driving that, how effective different interventions they have going on. So there's, I think, a constellation of different issues. I think sort of in parallel to that, there's issues related to the model's methodology itself. You know, are prices being projected accurately or in line with what's actually happening? Things like that. There's a lot of complex financial modeling that's involved in OCM, and a lot of what's being done is predicting prices, and I think that's a complicated thing to do in a domain such as oncology.